Pancreatic cancer can be a silent threat, often showing subtle signs that are easy to overlook. Understanding these unusual symptoms could potentially save lives. You might be surprised to learn that seemingly unrelated issues like unexplained weight loss, new onset diabetes, or even a change in your skin tone can be early indicators of pancreatic cancer. In this video, I'll explore strange signs that could signal a deeper health concern. By recognizing these symptoms early on, you can take proactive steps towards seeking medical advice and potentially catching pancreatic cancer in its early stages. Stay informed and empowered to prioritize your health and well being. When it comes to understanding pancreatic cancer, it's essential to grasp the basics of this condition and factors that contribute to its development. Here is an overview of pancreatic cancer and the key factors that play a significant role in its occurrence. Pancreatic cancer is a type of cancer that develops in the pancreas, an organ located behind the stomach. It is known for its aggressive nature and often goes undetected in the early stages due to a lack of specific symptoms. By the time symptoms manifest, the cancer may have already reached advanced stages, making it challenging to treat. Understanding the risk factors, symptoms, and diagnostic methods can help in early detection and better management of the disease. Several factors contribute to the development of pancreatic cancer, including age, family history, smoking, obesity, and chronic pancreatitis. Age is a significant risk factor, with the majority of cases diagnosed in individuals over 45 years old. Family history of pancreatic cancer or certain genetic syndromes can also increase the likelihood of developing the disease. Smoking and obesity have been linked to a higher risk of pancreatic cancer, highlighting the importance of lifestyle choices in disease prevention. Additionally, chronic pancreatitis, a long-term inflammation of the pancreas, can elevate the risk of developing pancreatic cancer over time. Understanding these key factors can aid in risk assessment and early intervention for pancreatic cancer. 12 strange signs of pancreatic cancer. Pancreatic cancer can exhibit various unusual symptoms that may seem unrelated but can indicate a serious underlying condition. It's essential to be aware of these 12 strange signs that could potentially signal pancreatic cancer. Changes in stool appearance. If you notice pale, greasy, or floating stools that are persisting, it could be a sign of pancreatic cancer affecting your digestive system's normal function. Sudden onset of diabetes. Developing diabetes without a family history or significant lifestyle changes may be linked to pancreatic cancer affecting insulin production. Unusual body odors. Unexpected changes in body odor that are not resolved by usual hygiene practices could be a subtle indication of metabolic changes due to pancreatic cancer. Persistent itchiness without rash. Constant itching on the skin without any visible rash or irritation may be a result of pancreatic cancer, related bile duct obstruction, or other metabolic disturbances. Abrupt weight loss with digestive issues. Rapid weight loss coupled with digestive problems like bloating, nausea, or indigestion could signify pancreatic cancer affecting your body's nutrient absorption. New onset depression or anxiety. Experience unexplained feelings of depression or anxiety that are unrelated to known stressors might be a psychological response to underlying pancreatic cancer. Blood clots in unexpected areas. Developing blood clots in unusual locations such as the abdomen or legs could be a sign of pancreatic cancer impacting blood clotting mechanisms. Abnormal fatty tissue alterations. Noticing changes in the distribution or texture of fat tissue in your body, especially around the abdomen, could be a subtle indicator of pancreatic cancer affecting lipid metabolism. Fluctuating appetite levels. Experience sudden changes in appetite, such as loss of interest in food or constant hunger without apparent reasons, might be an early sign of pancreatic cancer affecting your digestive processes. Low blood sugar episodes. Experience episodes of low blood sugar levels without a clear explanation, especially if not related to diabetes or dietary factors, could be linked to pancreatic cancer affecting insulin regulation. Unexplained fatigue. Persistent fatigue that doesn't improve with rest or changes in sleep patterns could be a symptom of pancreatic cancer's impact on energy metabolism and overall health. Frequent fevers or infections. Facing recurrent fevers or infections without a clear cause may indicate pancreatic cancer's effect on your immune system, making you more susceptible to illnesses. Diagnosing pancreatic cancer. Early detection of pancreatic cancer plays a vital role in successful treatment. By recognizing the unusual signs and symptoms early on, you can improve your chances of prompt management and better outcomes. Understanding the diagnostic process is essential for timely intervention and personalized care. Detecting pancreatic cancer in an early stage significantly increases the chances of effective treatment. As symptoms can be subtle and easily missed, being aware of the strange signs mentioned earlier is crucial for early diagnosis. When pancreatic cancer is suspected based on symptoms or risk factors, healthcare providers may recommend various tests and procedures to confirm diagnosis. When it comes to treating pancreatic cancer, there are several options. cervical interventions, chemotherapy and radiation therapy, emerging treatments and clinical trials. So we've now explored the 12 unusual signs that could be indicative of pancreatic cancer. Recognizing these signs early can make a significant difference in diagnosis and treatment outcomes. Stay informed about the latest advancements in pancreatic cancer treatment options. By staying vigilant and informed, you can take steps towards early detection and potentially improving your prognosis. Stay empowered and prioritize your health by being aware of the signs and seek medical attention if you notice any unusual symptoms.